or ice? Great question. I'm going to answer that and take you through this amazing product which does both and makes the application a whole lot easier. Welcome to Dr. Kez's Chiro Lab. I'm Dr. Kez, Doctor of Chiropractic. If you're new to this channel, consider subscribing so that you don't miss any of the latest content. Now, heat versus ice. It is a really good question. We're going to talk a little bit about heat. It's less frequently used and it's about muscles, and more muscles. Muscles do love the heat, joints don't. So if you've got a muscle issue, more like a tired or fatigued muscle or cramping muscle, then heat is absolutely fantastic. But we do want to make sure that you don't get it over the joints because the joints just don't like the heat. Now, ice. 90% of the time, the answer is ice. Any acute injuries of any kind require ice because you've done micro tears of the vessels and they bleed into the joint. We want to prevent that from happening. So it causes constriction of the vessels to prevent further bleeding and further damage to occur. Really important. You've possibly heard of RICE or RICER. R for rest, I for ice, C for compression, E for elevation, and R for a referral to someone like myself, a chiro. Now, how long do we use ice for? That's a very good question. It really does depend on the type of injury that you've done and the extent of the injury. But one good thing about this is that your body generally tells you when enough is enough. So our ice protocol is to put the ice on for 10 minutes so that it can constrict the vessels and then take the ice off for a further 10 minutes to allow the fresh vessels to come in and help with the healing process. Really important. A lot of people think, oh, if I can just handle having the ice on for half an hour, that'll do the job a whole lot quicker. Not the case. We have definitely found in research that having the ice on and removed is actually so much better for the healing of the joints. So on and off and on and off. After you've done that for about an hour, with an acute injury, you'll find that the joint feels a whole lot better. You might find in a couple of hours time that it starts to become achy and throbby again. That's when you know to start the protocol again. 10 minutes off, 10 minutes on, off, and continue that until you find that the joint feels or the area feels a whole lot better long term. When you go to bed at night and you get up in the morning, keep in mind you've been in a warm environment, you will probably need to start the process again. So that's really important to know. So the more acute an injury, the longer you'll need to do it for. Really good. Now, let's talk about icing. Don't use an ice brick, okay? These things are too rigid and they don't mold to the area that you want them to be used for. No good. Old-fashioned packet of peas. These actually aren't such a bad idea. They do mold nicely to your joints, which is what you want. You want to be able to get the ice all the way around the injury. The only problem with these guys, of course, is if you forget to put them back in the freezer, you're going to be eating peas for a week. Now, what we like to use is the gel packs. Gel packs, again, really malleable. They mold around the area. The trouble that we have with these, and similar to the pack of peas, is that you're kind of stuck on the couch. So if you're going to be icing on and off for an hour, as much as we all like to sit in front of Netflix, it means that you can't really do anything else. Because as part of that RICER, compression is really important. So you really do need to have the area of ice compressed up against your body. So unless you're going to walk around with your hand on the ice, which after a while gets pretty cold, I can tell you, it is a little bit inconvenient. So that's where this beautiful new invention comes in called Wrap on Ice. This is designed with two great features that I love. The first one is there's a layer between you and the ice pack. If you were to place the packet of peas or the gel pack directly on your skin and leave it there for the 10 minutes, there's every chance that you will cause an ice burn, which is horribly painful and it's just going to add to the injury, not what we want. So this holds it in place and allows you to compress the area. So we wrap it up, or Velcro it up like this, so it holds the ice onto the area that you're treating. Absolutely fantastic. So you're not going to get the ice burns, you've got the convenience of it being compressed against you, and best of all, you can go about your daily activities while you're icing at the same time. Really great product. Click on the link below. There is some information on where you can get these. They not only come in this size, of which they come with 2 ice packs, which is really great, And I did mention that they do heat and ice, so you can heat them, pop them in the microwave, or you can use them in the freezer. The benefit of having two, of course, is that one can continue to remain cold in the freezer while you're using the other one. When you feel that the cold has gone, or that it's gone onto your body and it's no longer in the ice pack, you can swap it over and use the other one. Really handy. There's two different sizes. They come in small sizes, really great for kids or really small areas like a wrist or an elbow, or this large size. Like I said, this comes with two ice packs, this one just comes with the one. Again, interchangeable, heat and ice for both of them. Links are below, check them out. They're actually a really, really handy product for any type of icing that you need. Thank you very much for having us on your therapeutic journey. We look forward to catching you in our next video.